Hello. Today I would like to share with you the top 10 sperm killers. Aside a woman's age and other female factors that are known to be responsible for a couple's difficulty in achieving pregnancy, male infertility is equally an important cause that can prevent the couple from achieving pregnancy. So today I will share with you the top 10 factors that affect the health of the sperm and some key points that you should look out for regarding male infertility. I am Christiana Mausi Sayram, a public health practitioner with a specialization in maternal and child health, a proud product of University of Nebraska Medical Center, and a Fulbright scholar. So just a little background to male infertility. Do you know that about 40% of all infertile couples, their infertility is caused by male factor? Yes, I know there is that myth that men can have children regardless of their age. So many researches have shown that that is not true. And we will look at the detail very soon in one of the points. So, by the way, for you to say a couple is infertile, medically, the couple or individual would have had regular, consistent, unprotected sex continuously for at least 12 months or 1 year without achieving pregnancy before the person or the couple can be termed as being infertile. Thanks to our evolving science and technology today, it's easy to diagnose infertility, especially male infertility, and then the appropriate treatment given. So when a couple have infertility, which is due or which has been found to be due to male factor involvement, meaning the cause is likely from the man, typically the first test that will be done include semen analysis. BMI, the man's BMI will also be examined to see whether it's within the normal range, his medical history, his lifestyle choices. All these assessments will be done by the fertility experts. So what do we expect to see in a normal semen analysis result? We are looking at the volume of the semen that is produced. Is it up to at least 1.5 mil? The sperm count per ejaculate, meaning when a man ejaculates, the number of sperms that should be in the ejaculate, that fluid you see, should be at least 39 million. So we expect to see 39 million sperms. Or if you take 1 mil of that fluid, that semen, you should see at least 15 million sperms swimming in that 1 mil of the semen. Then we also look at the motility, that's the movement of the sperms. Are they moving aggressively in a forward direction? Then the morphology, the shape, the size of the sperm, is it normal? We also look at that in the semen analysis. So now let's look at the top 10 killers, sperm killers. The first one is smoking. And smoking causes oxidative stress on the sperms. What happens is that when the sperms gets produced in the testes or the testicles, they pass through the production line, and as they pass through the production line, they get attacked by oxidants, and these are usually free radicals that are circulating in the man's system, and this comes as a result of what? The smoke or the cigarettes that the man is smoking. And these oxidants prevent the sperm from swimming. These oxidants can also damage the DNA of the sperm. The head of the sperm contains the DNA. The oxidative stress does not change the DNA of the sperms. However, it destroys how the DNA is packaged in the sperm cell. So this affects the movement of the sperm. And the sad part is that some of the sperms get killed as they move during ejaculation, or as they move through the production line after being produced in the testes. So this will definitely affect the man's chances of fertilizing an egg to achieve pregnancy. Second point is alcohol. Alcohol can affect male fertility in many ways. Alcohol increases a man's estrogen level, and this results in two things: reduce sperm production and reduce sexual function. It's important to limit alcohol consumption to a moderate amount. At least 1 or 2 standard drinks once or twice a week is manageable. Then the third point is recreational drugs, such as cannabis. So many researches have shown that the smoking of cannabis or weed can actually affect the swimming capacity of the sperms. So what happens is that the sperms become literally dizzy when produced, and they cannot find the egg and fertilize it. Then the second recreational drug is steroids. These days, because of Facebook, Instagram, every man wants to look, in a certain way with the apps and so forth. However, the side effect is that continuous use of these steroids can result in what? Absence of sperms in your semen, which is known as azoospermia. And what happens is that when a man continues to take steroids, the testes stop producing its own testosterone. And the steroids you are taking are synthetic form of the testosterone. So you are putting in testosterone. So the testes stop producing the natural testosterone. And what happens is that sperm production also stops, because testosterone is necessary for sperm production. So it will be difficult for this man to be able to achieve, fertility potential. The fourth point is excess weight gain. If a man accumulates body fat around his tummy area, this fat doesn't stay idle. It's actually hormonally active, and it begins to transform your testosterone into estrogen. And high estrogen level in a man is detrimental to his sperm production. Not only that, excess body fats around the thighs or in the pubic area can also reduce ventilation around the scrotum. The scrotum is the sac that you see. The two balls that are in the scrotum are called the testes. The testes produce the sperms. So naturally there should be a lot of ventilation around there to encourage sperm production, because warm temperatures do not favor sperm production. Then the fifth sperm killer is the bad diet, what you eat. High cholesterol food, fatty food, pizza, fried foods. Actually, it's recommended that once you hit age 40, you should limit or avoid fried foods. Healthy diet, green vegetables, foods high in antioxidants such as fresh tomatoes, oranges, strawberry, avocado, pecans, carrots, mangoes, etc. are very good. Then the past medical history or past medical conditions that the man had. For example, if a man had undescended testicles in childhood and it was corrected through surgery, that can increase his risk of having infertility later in life. Hernia or hernia repair surgery, any operation in the pelvic area also increases your chances of having your sperms killed or infertility. Then pelvic trauma such as motorbike accidents or previous sexually transmitted diseases such as gonorrhea, chlamydia, and so forth can also affect your sperms. Acute viral illnesses such as mumps or flu, severe flu. These illnesses actually cause increased body temperature, which puts a hold on the sperm production. Remember, I said earlier that we don't need warm temperatures. It does not favor sperm production. So these illnesses increase your body temperature, which in turn puts a hold on sperm production. and this can interfere with the sperm production cycle. Then the eighth sperm killer is exposure to environmental toxins and chemicals. Per occupation, some people, their industry, as a result, makes them become exposed to so many chemicals and toxins, and sometimes they come in contact with this chemical directly to their skin or through inhalation. Chemicals such as pesticides, BPA, which is found in some plastics, and so forth. BPA can also be found in the lining of some cans that are used to can food, various types of foods. So we want to be able to avoid those. Then exposure to chemicals such as mercury and lead is also not good for the sperms. Certain workers, specifically metal workers, welders, they come in contact with a lot of heat and some chemicals, and research has shown that they tend to have problem with sperm motility. So it's very important to use the protective gear to reduce some of these effects. Then the ninth sperm killer is advanced paternal age. As a man ages, his fertility level drops. And not only that, there are certain genetic conditions that can be more common in men who are older when they want to have kids or they have children. That can lead to certain genetic problems. And our next video will be on paternal age and its effect on male fertility. Yeah. Then the last but not the least, hormonal problems, erectile and dysfunctional and ejaculation problem. So if you cannot perform sexually, definitely there will be a delivery problem. So it's important to seek medical care so that you can put on some medications to help you achieve good erection and ejaculation. So in summary, the top 10 sperm killers I talked about are smoking, alcohol, recreational drugs such as cannabis and steroids, excess weight gain, bad diets, past medical conditions such as car accident, motor accident, hernia, undescended testicles, viral infection, exposure to environmental toxins, advanced paternal age, hormonal problems, then erectile and ejaculation problems. Feel free to send your comments and questions to christiana.achu@fulbrightmail.org. I'll take that again. christiana.achu@fulbrightmail.org. You can also call or WhatsApp 050-174-2759. 050-174-2759. Please watch out for my next video on how age affects male fertility. Thank you.